Hi, I'm Tim Bradner. Welcome to Capitol Views, and welcome today to newly elected Representative Genevieve Mina, representing District 19, East Anchorage. Welcome, and thank you for joining us on Capitol Views.
Thank you, Tim.
Uh, Genevieve, you come to the legislature. You're new to the state house, but you come to the legislature with some degree of legislative experience. You were staffer to Representative Ivy Spondholz doing work on healthcare legislation. And you're on the Health and Social Services Committee in the House, so you come in with a fair amount of experience. Maybe just describe some of the work that you've done with Representative Spondholz and the experience that you bring in to the legislature, plus a bit of your personal background.
For sure. I come into the legislature with a passion for healthcare and healthcare policy, and a lot of that comes from my upbringing. I come from a family of healthcare workers, primarily nurses and caretakers, and my family ran a small business for almost 2 decades, running assisted living homes and taking care of elderly residents with dementia and Alzheimer's. And so that is a lot of the framework that I come into thinking about Medicaid and healthcare policy. And over the past couple of years, I've worked in government as in a political aide. I worked on campaigns, and I've also worked in the nonprofit sector on communications. Most recently, I've worked for Representative Ivy Spondholz, and I've been a point on her health and social services issues, helping her on her committee and helping with legislation. I carried her telehealth bill, which was signed into law last summer, and I also interned for her in 2017 through the Ted Stevens Legislative Internship, where I did supplemental research on her healthcare price transparency bill.
Well, Genevieve, just touching on telehealth, I mean, that's an important service that's provided to Alaskans. Maybe you could describe what was done and what was accomplished in the legislation that you worked on in that respect.
Yes.
Yeah.
Yes. So the telehealth bill that we carried last year, House Bill 265, focused on making the telehealth flexibilities that were enacted during the COVID-19 pandemic and making them permanent in the state. And a big issue was that there were a lot of uh, regulations that required in-person visits prior to enacting a telehealth appointment. Additionally, there were requirements where you needed to have someone in person on top of having your main medical provider if you're getting prescribed controlled substances, which can be a barrier with substance use disorder treatment. And furthermore, it was rectifying inequities and payment parity and ensured that Medicaid would be reimbursed at the same rate as an in-person visit for telehealth appointments.
And this was important because a lot of providers had to make a substantial investment in telecommunications equipment.
Yes, partially it was a bit of investment for some providers that had not had telehealth equipment. But keep in mind, many facilities and providers had been doing telehealth during the pandemic. And telehealth and telemedicine doesn't have to be only a tele appointment visit, but it can also be through phone calls and audio only appointments. And so those phone calls are really helpful in rural Alaska where internet access may be spotty and it is very accessible for mental health and counseling and people who really need care at the time needed.
Well, Genevieve, one of the issues that has always been a problem for Alaskans is doing, particularly in acute care situations with cancer and certain types of complex diseases, doing appointments and consultations with out-of-state providers. Um, right now, it's still required. A in-person visit out of state is required before that can be done. Or did the telehealth bill handle any of that? And how was payment provided for?
Yes, so I can answer the latter part first. Payment is still reimbursed at the same rate if it is provided as if it were provided in person if you are covered through Medicaid. But in terms of out of state visits, especially for people who have a life threatening condition, the telehealth bill did two unique things. The first was that it allowed for an individual who already had a procedure done out of state with a physician, such as surgery, et cetera, to be able to do consultations and follow up visits through telehealth rather than forcing the individual to travel out of state and then to do telehealth and then travel back to Alaska. And the second thing that it did, it is that it allowed for a person with a life threatening condition to do a consultation directly through telehealth with someone who is a physician licensed in a different state if they had a referral from an Alaska licensed physician.
Well, you mentioned the follow-up visits from a surgical procedure, that could be that's a big deal. Yeah, having a procedure done out of state, and then if you prior to the bill passing, people had to, travel out of state for follow-up visits?
Yes, yes, they did. And we heard many anecdotes and testimony of people who traveled to Seattle and would stay in the Alaska Airlines airport, do their telehealth visit from the airport, and travel back. And so we know that travel is such a burden for a lot of Alaska residents. And we wanted to make sure that we could increase access to healthcare for Alaskans who are facing really life threatening conditions.
Well, that was a real accomplishment. Just in the quick time that we have left, Genevieve, are there any tweaks to the telehealth bill? You're on the Health and Social Services Committee this year. Will you be working?
Yes. Yes, I know that there's a lot of conversations about different providers and telehealth access outside of physicians. And the telehealth bill was fueled by the healthcare community, including advocates. And I look forward to continuing conversations to ensure that everybody is on board and that we are creating policy that is driven by our experts and the people who receive care.
Are there any particular gaps in it that come to mind that need near-term fixes?
I know that behavioral health is a huge focus for many people in the legislature and for Alaskans, and I hope that we can look at ways to expand behavioral health access, either through telehealth or through licensing or other means.
Well, there's a lot to be done. And in any event, thank you, Representative Mina, and we look forward to talking more with you and Juneau about this. Thanks for joining us today on Capitol Views.
Thank you, Tim.